Les décès, les hospitalisations, les absences des travailleurs de la santé, tous ces indicateurs-là ne cessent de décroître et nous montrent que nous avons eu raison de faire en sorte d'amorcer graduellement un retour à la normale de manière prudente.
Quebec Interim Public Health Director Dr. Luc Boileau saying all indicators showing that the decision to gradually return to normal in a cautious manner was the right one. At a press conference in Montreal on Wednesday, Dr. Boileau adding that updates would now be less frequent and only when the situation calls for it. That cases, hospitalizations, deaths, and absences among healthcare workers are declining, calling it very encouraging. The National Health Institute, INES, published new projections that also continue to suggest the pace of hospitalizations will slow over the next 2 weeks to about 55 daily. This as masks in most public spaces comes to an end May 14th. Except for public transit, hospitals, clinics, CHSLDs, and for those who test positive for COVID and are out of their isolation period. Masks won't be required in mental health facilities, though, but are still recommended for some.
We will of course, strongly recommend that people that are immunocompromised still wear a mask when they go outside in public spaces. We will try to enhance the tolerance to mask wearing and recommend also that people as a politeness, wear masks when they are in crowded places where there may be a risk.
There was a study published in MMWR last week on May 6th where the US followed people who were wearing masks or not. And so depending on your mask wearing, you had a decreased risk of catching COVID by 70%. So I think we have to also understand that the mask is also protective from others, even if you're going into a room full of COVID. And the best fit for that mask is what protects you most.
Dr. Boileau adding that they will reevaluate the mandate for public transit in the coming weeks. He also addressed the confusion about Quebec's stance on booster shots. Third doses recommended for all adults as well as pregnant women and healthcare workers, and those 12 to 17 who are at high risk of complications from COVID. Fourth doses available to the 18 plus but recommended for specific groups. That includes those in long-term care homes and seniors' residences, as well as 80 and older living at home and those who are immunocompromised. A new report by Quebec's Auditor General says the province overpaid on personal protective equipment during the early stages of the pandemic by almost $1 billion, and that the government was unprepared and rushed into purchasing them at high prices.
Main interest for me right now is to make sure that we are ready to face any other situation for this actual sixth wave, of course, but for another one that could come in the next few months. So we have to be ready, and we'll take care to note everything that has to be noted to make sure that we're ready. But so far, we're working very seriously on that. I'm telling you, it's an objective that is the same for all the team. We have to be ready.
In Montreal, Brittany Henriques, City News.